My name is Michael Rubino.
I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Hello, and thank you for joining us for another episode of Never Been Sicker. I'm your host, indoor air quality expert Michael Rubino, and today's very special guest, will you please introduce yourself to the audience?
Hi guys, my name is Rich Wallace. I'm a physician. I have an urgent care center not too far from here, and I've been doing urgent care for a long time. Let's date myself. Graduated med school in 2000, and then I did a family medicine residency, and then a sports medicine fellowship. Dove into the world of urgent care, and then never left. And I've been doing that since 2004. So there you go.
Why urgent care? Obviously, you had so many different lanes of medicine. Why did you pick urgent care?
When I was doing my sports med fellowship, we'd moonlight at urgent cares in St. Pete. And I ended up liking it a lot because it was such variety. It was old school. So we had, paper charts. There wasn't this whole EMR thing. So you'd walk up to the door and you'd take out the chart out of the folder holder. And that's the first time you saw what was going on. So you didn't really have a chance to prep. You just kind of walked in the room and you had to figure out what the heck was going on and handle the situation. And I liked it. I liked the variety. I liked the, just having a lot of random stuff come at you and then being able to figure it out on the fly. And people were very appreciative of the help, and I liked it. And so more exciting, wasn't redundant. Like some of the times, in the sports med clinic, you kind of do the same thing. How many times can you inject a shoulder? How many times can you inject a knee? I mean, it's still fun. I still do that stuff. I still, inject shoulders and knees and other things, and help with the sports medicine stuff. But the urgent care world definitely gave you a lot more variety. So it was just more my speed. I like the randomity. All the random stuff happening. Yeah.
Sounds like you're a problem solver, because in order to be able to handle so much random motion, you got to be able to solve problems.
Yeah, exactly. So that's true. That's a big part of it. In fact, I think most people don't realize that when you're a doctor, that's really what you're doing. You're kind of like a detective. You try to figure out the problem, and then the next step is to actually educate the person on how to handle the problem. So that's how it is. It's like a whole process. The person comes in, drops a few clues. And then if you know the answer, you give them the answer and then say, hey, this is what's going on. This is what we need to do to handle it. Or if you don't know the answer, you just kind of like try and find more info to figure it out. So detective work, yeah.
Makes sense.
Yeah.
Now, obviously in urgent care, you're not just dealing with people coming in with illness, but there's injuries and all kinds of things that happen. What would you say on a average basis, you're dealing with illness versus injury versus accidents?
It kind of varies. It's actually pretty seasonal. Like right now, we're kind of, we still have a couple of cold fronts coming through to Florida, which might not, be cold fronts to other people, but it gets cold enough here. And I find that when the cold fronts come through, you see a lot more respiratory stuff, a lot more, colds and, bronchitis, pneumonia, stuff like that. I feel like, when the air is colder, your airway gets smaller, tighter, more restricted, more mucus production kind of traps things more, so you're more likely to probably develop infections, things like that. Also, that time of year, most people are stressed. They're hanging out with family that they don't want to see, so that kind of lowers the immune system.
Sure.
And so you tend to see more respiratory stuff, in like December, January, February, and it kind of calms down as you kind of roll into March.
I got a theory. You want to go down a rabbit hole with me?
Go for it.
All right, cool. So in the wintertime, or when there's cold fronts, like here in Florida, it gets 50 degrees, but people don't understand. If you're not from Florida, you're wearing like parka jackets when it's 50 degrees, right? But the heat goes on.
Right.
And I want to think about, especially in places like the Northeast where I'm from, or places like Florida here, where you have the AC running and then it switches over to heat. Well, that high heat, that dry heat actually passes through the evaporative coil. And then it breaks apart particles like mold and bacteria, and it disperses them across the environment. And then think about it, in the wintertime, people are more indoors, right? Because it's cold. They don't want to put on a jacket and go outside.
Right.
And especially in Florida, it's like all throughout the year, you can go out all the time to eat at restaurants at night, and you're active, you're outside, you're moving. Well, then in the wintertime, you're closed in, windows and doors are shut, you're cold, you've got that HVAC breaking down mold and bacterial particles that are then circulating throughout the air. And then, of course, you're more indoors. So I think that there's something there, because then if your immune system's weakened, then you can get more common colds, more flus, things like that.
Right.
So just wanted to plant that seed.
I kind of agree with you to some extent. I think definitely in the the season, most people are kind of packed in tighter than normal. So you're right. Not many people are outside, spread out. A lot of times you're, traveling a lot. People are flying on planes. They're with family more. So you're stuffing a house that normally has 4 people now has like 10 people. So there's more bodies in smaller spaces or in the same size space. So they're breathing each other's air more. And and there's definitely, that's true. In the winter, you definitely have more of the heat turning on and there could be more stuff flowing around. So that makes sense.
Yeah.
I agree.
Now, obviously, we talk about kind of the illness component for a second and some of the seasonal changes with your business. And then you also deal with accidents, injuries, and obviously that is completely random because accidents are random.
Right.
And is there anything that you see happen more frequently, that any sort of patterns on that side of things that you notice that happen more frequently?
I mean, in an urgent care world, you see basic like lacerations. People cut themselves all the time, doing random stuff. Interesting. I feel like there's more injuries in the summer than in the winter months because usually the summer is when people are out and about trying to work on those projects that they never worked on. And we definitely see more, I would say, more injuries and lacerations and stuff in the summer versus the winter. The winter, you tend to see a lot of respiratory stuff. Like that's the time of year my smokers and my lung people tend to show up at the urgent cares a lot. Is when the temperature drops, they tend to come in a little bit more frequently.
That's so interesting.
Yeah.
On the laceration side of things, they're just accidents. People are doing stuff and accidentally cut themselves.
Yeah, just simple stuff. Cutting stuff on glasses or break a glass while washing it or something. Simple stuff. Just enough to where they have to come in and get handled, but they hurt themselves in the summer, it seems like.
Wow. Now just shifting gears back to the illness side of things for a minute, because this podcast is called Never Been Sicker, right? Mm-hmm. And have you seen a increase in illness in foot traffic coming through your business over the last few decades?
For us, it's weird. It's like, the stats used to be pretty predictable up until about 2020. So up until like we opened our urgent care in 2012, and then we had a steady growth where every year you'd see a certain percentage increase in patient volume. You could kind of predict, the months where you have certain illnesses. And it was almost like, this is flu season, this is strep season, this is whatever season. So you kind of predict what's going to happen. And then I would say after, the COVID, the game, it seems like it's a little bit unpredictable. So I feel like there's definitely been more illness, things in the sense that it's not as seasonal as it used to be. Whereas before it was easily predictable. Now it's not. It's not like, okay, now we're going to hit a flu season. No, now it's like everything. You got, all these different viruses popping up and they don't really take their turn. They kind of come, more frequently, I think. So I think that's probably one of the biggest things I've noticed is that the predictability and the cyclical type of illnesses, it's not really as cyclical as it used to be. Maybe it's just that's what I see. So my perception is that it's a little bit more than what you'd expect or a little bit unpredictable. And so that's probably one of the biggest changes I've seen over the past few years is just the types of illnesses and viruses and bacteria that people are getting. There just seems to be a little bit more variety rather than just like, okay, strep season, So it's become a little bit more unpredictable. Yeah. It's just random. It's just, we'll have, like before I could literally, it was easier to treat because you knew, 90% of people coming in had flu A or something, right? And then now it's not the case. They come in, you think, you have a couple, people coming with flu, but then not everyone has the flu. Whereas before it was, I remember example, I think it was like 2018 or 2017, we had a big flu year. I think we would test, like we would have 80 people come to the clinic, at least like 50 or 40 of them were flu positive.
Wow.
And it was just like, it got to the point where when you were in season, you knew what the person had. You didn't have to think. You didn't have to waste time. If they wanted to get swabbed, they could, but for the most part, it was pretty straightforward. This person has flu. But we would swab. And so you'd swab like, X amount of people and you'd see, a ton of positive flu tests and they all had the same thing. That doesn't happen anymore. The days of having I take it back. After COVID, like after 2020, it's not predictable anymore. Now it's like someone walks in with a respiratory infection. Sometimes you can tell clinically, like it looks more like a strep or more like a flu or more like a whatever, but it's kind of harder now. Now it's like, it's not as predictable. you don't have just one thing coming this week and then one thing coming the next week. It's kind of like a hodgepodge of a little bit of everything, which is kind of unusual because that wasn't always the case. But now it is. So it's a little bit more difficult for us to kind of figure it out.
Sounds like the immune systems might be getting weaker and being more susceptible to illness in general because you're having all these random illnesses pop up.
Yeah, I think the days of the quarantining wasn't a good thing. I think, that definitely, kind of made everyone a little bit more susceptible to stuff because normally these, viruses and things would kind of run their course, and then everyone kind of developed that, what they call a herd immunity, where everyone just kind of has, it's not a big deal. And you kind of run through it and everyone gets antibodies to it, then it's not a huge problem. It kind of dies out,
Sure.
And then when we stuffed everyone with a mask on their face, and then, I feel like, after we kind of stopped that game, we seem to get more a variety of things again. Whereas before you didn't see that. So
yeah, that makes sense. I'm curious, you ever see chronic illness patients? I know obviously in urgent care, so you're going to have these more random things pop up, but do you have patients that are considered repeat customers or dealing with chronic illness and you're trying to help them sort that out?
Yes, we definitely have a following. There's a lot of patients who don't have a primary care physician that use our clinic as their primary care or their doctor or their go-to. So yeah, I would say a good percentage of, I think not just myself, but I think a lot of urgent cares are now becoming primary cares for the population. So yeah, we do.
That's actually true. I think you guys are actually listed as my primary care physician because you're down the street.
It's not just you, man. It's like a lot of people use us just because people don't have primaries anymore. They just, because it's the convenience factor. It's like you need to be seen. You call up your primary. I can see you in 3 weeks. It's like, okay, great. I have a problem right now.
Right.
And so they'll just go to an urgent care and get it done. It's just a lot easier.
Right. I mean, lucky for me, I've been blessed and haven't had so many health issues. And so, but I should probably come in and just be proactive and get another physical or something. And, what are some things people can do proactively inside these urgent centers?
I mean, that's a very good thought. Most of the time, if a person is proactive, I always tell people just at least once a year, just kind of do a once over, like a maintenance check, like I'm 52 now, and I remember I had
You're really 52?
I'm really 52. Yeah.
Wow, that's incredible.
Yeah. So
I would have never guessed that.
Most people don't. They think it's funny because I have guys that are like, when I was your age, I'm actually older than them, and it's actually pretty funny. I'm like, I'm actually older than you. But I had a surgery, a knee surgery a couple of years ago, and then when I had the surgery, the doc was like, you need to do EKG and labs. I'm like, really? He's like, yeah, you're over 50. I'm like, oh yeah, that's right, I'm over 50. So I forgot that, once they get older, you're now considered a higher risk patient. So they want to check you out and be more thorough. So, and I started doing that, I guess in my late 40s, I would start just checking basic labs every once in a while, like once a year, just to kind of make sure everything is good, because you never know. And then basic labs are good. It's kind of like just, your gauge, your biometric gauge, you kind of, you make sure your height and weight are good, make sure your pressure is good, make sure, pulse is good. And then you just sprinkle in some labs. And I would say, once a year, if everything is good, you're probably fine. Especially if you're moving the body and exercising and you're keeping your weight, in a pretty stable range, you're probably not going to have a lot of significant problems. It's when you kind of let those things fall off and not pay attention to them that, problems start.
I like the idea of a routine check. I mean, I'm always recommending people do routine checks on their house. Yeah. Check their roof, check their windows and doors, make sure there's not water intruding, things like that. I think it's really smart because then you can be proactive. Right. You can fix problems when they're a little bit less expensive to fix. Right. As opposed to waiting for a major meltdown. Then now all of a sudden you've got to replace all your windows, replace your roof. Now there's mold. You got to deal with that. There's all this water damage. You got to deal with that. And so it's obviously a lot more cost effective to be proactive. So it's great that you can kind of take that approach.
That's 100% correct. I feel like when guys do that, you find a small thing that's a little bit, not quite right, you can jump on it right away and figure out what's going on. And then it's usually a quick, simple fix, quick handling, and the person's fine. And then you're right. When you wait too long, things progress. It turns out what was a small thing actually is a big thing, and it's progressed into a big thing, simple stuff that if you jump on it early, it can be handled and taken care of, and it's not a huge body problem. And the guys that come in and get checked out regularly, they're on top of it. And when you find something like just a very subtle, thing can kind of mean something. So you just pull the strings, figure out what's going on, and then handle whatever the situation happens to be. And it makes it quick and simple. Whereas if you wait, I'm thinking of like 1,000 different scenarios of how that can apply. But for instance, you have a guy who, comes in for like a once a year lab thing. He's like, late 40s, early 50s. Decide I'm going to do once a year, check things out. So then he checks out some blood tests and it comes back his kidney function is off and he's never had off kidney function before. And like, why is that the case? And you kind of, then you kind of go backwards and try to figure out why is his kidney function, not the way it should be. And then maybe it turns out his prostate's getting enlarged. And then you go, well, why is your prostate getting bigger? And then you kind of pull the strings and then you figure out what's going on. And then, rather than have it become a big problem where he never really checked and now his kidneys are like super, not working properly, just by jumping on it early, you could figure out why is it not working. And then you kind of go back and figure out, oh, he's got a large prostate. We need to do something about it. And then you fix that issue and then kidneys can start working again. And, he doesn't have to come in with an emergent issue where, hey, my kidneys are shot. They're not functioning. What do I do now? Well, then it's like, okay, now we got problems. Now we got big problems. Mm-hmm.
You know what? I love what you just said. Basically, you're talking about essentially finding the problems, the root cause issues that are happening. You're not just saying liver's not working. We're going to do, we're just going to focus on the liver. Well, it's like, no, what's causing the liver not to work? And you keep pulling that string, looking for the root cause. I think is so important. Yeah. And I would argue that has to separate you from other urgent cares across the country because I feel like it's more conventional that way.
Yeah, that's how we operate. We always try and figure out what's going on and we try and, get to the bottom of things and find the root cause. I know that I've seen that word tossed around, but I feel like you're not really practicing medicine unless you actually are doing that. So if you're not really trying to find the why, you're just putting a Band-Aid on it. So we actually, go over the labs that we draw on people. We actually look at the imaging studies and figure it out. A lot of times when people go to urgent cares, they'll get stuff done, diagnostic stuff done. And then the thing is, hey, if we don't call you, everything's fine. Follow up with your primary. And it's like, all right, what did that mean? It means nothing, I've been at clinics when I was doing my training in med school and residency. That was a common thing to where people would say, hey, just if we don't call you, everything is fine. I'm like, oh, that's not how it works. You got to if you order the study on the person, you need to figure out what's going on. What does the study result mean? And then what's the next step? So it's not just sign your name and then email the results to the patient. It's like, no, sign your name, but then you have steps as to what's the next thing we're going to do. Right. So if someone comes in, you check whatever, say they have high cholesterol. Okay, fine. Then you have the person come back in and you talk about it. Figure, okay, great. This is what's going on. What can we do to handle this? How bad is it? What are the pros and cons of having high cholesterol? And then you kind of, give them the info on it and how to actually correct it if it's a problem.
So some of the arguments that I've heard people make in the past in regards to why they can't practice root cause medicine, essentially that the biggest issue is the insurance companies. They don't necessarily pay for people to be able to take all these different types of tests.
Right.
And that if they can't isolate what the problem is through different tests, that it's really difficult for them to be able to practice root cause medicine. And then therefore, they're just very more likely to give them a solution for the pain or solution for that, symptom.
Right.
So that they can get some relief because they feel kind of stuck.
Right.
And being able to identify root cause. How do you navigate that issue?
You're right. The insurance companies make it difficult where they just don't cover stuff if you don't. They have this thing called medical necessity. So you have to put down the correct diagnosis code that matches their algorithm that says they will pay for this, specific lab or procedure or whatever the case may be. So sometimes, you'll see doctors, when they want the patient to get labs, they'll write down 5 or 10 different diagnosis codes, on the lab script just so the insurance will cover the cost of the labs. And then to me, it's kind of it's almost like a little bit of insurance fraud, It's like you're just throwing a whole bunch of stuff on there and it may or may not apply to that specific patient. But it's like, if you don't put those things down, the insurance companies won't cover it. But then you're right. Sometimes you just want to figure stuff out and order some basic labs, but the insurance company, if you don't have specific, codes on there, they're not gonna cover it. And the patient has to pay out of pocket for it. And it does make it hard. And then sometimes you just tell the patient, look, you might have a bill and it is what it is, And so if the bill comes through, they understand that for whatever reason, the insurance didn't cover it and they just cover the cost that the insurance didn't cover. So, but you're right. That does happen often. And that used to dictate how people practice medicine. I mean, I should say for myself, I used to really pay attention and then think with the insurance game. And then I just stopped. I'm just like, I'm not doing this anymore. I just do what's medically necessary. And if the patient requests it, hey, you know what? I think, if they originate something, then I figure if the person has consideration, and if once they originate something, I have a consideration on it as well. So then I'm like, okay, obviously, this guy, Mike, is saying, hey, you know what? I think I think there's a pain right here, in my groin area. Okay, great. Let's get an ultrasound. Let's go check it out and see what it is. And even though there's nothing physically there, I'll still, order the studies just to figure out what's going on.
Now, with respects to chronic illness, that obviously you kind of mentioned that you're becoming many people's primary care physician just out of convenience. And that's probably not uncommon across the country.
Right.
So you're naturally then going to see more chronic illness and more autoimmune disease and autoimmune deficiencies. How are you navigating that? Like, how are you helping people get down to the root cause of that and, essentially helping them get better?
It's interesting. There's a lot, over the past couple of years, I've kind of realized that a lot of times people actually have allergies to things that they weren't aware of. And then, so like, for instance, foodborne allergies or environmental allergies, when I have a person who's just like a chronic, something isn't quite right, and we've checked everything out and we just can't seem to find the why. Sometimes you just do labs and just check for, environmental allergies, and it'll come back with something. And then it totally makes sense. Oh, you have an allergy to this specific mold. And then turns out that, I'm actually giving a case of a patient I saw the other day, never got headaches, and this is like she never really got sick, was a pretty healthy person, moved into a new apartment, and then all of a sudden now she's getting migraines, and she's never had migraines before. So she's trying to figure out why was going on. So she does a big, blood panel, part of which is an environmental allergy panel, and came back positive. She had a very high allergy to a certain type of mold, and pretty sure that was the cause of her headaches. So now, now that we know what's going on, the next step is to change the environment. So either she has to do some kind of mold remediation to the apartment, or just switch apartments. And so, so that's the game plan. The game plan is to basically, get out of the environment. So it helps, to dig through and kind of find that stuff out.
Yeah, obviously music's my ears because, I see people struggle with environmental illness all the time, and not every doctor knows to look for that or knows, how to even get that prescribed for them.
Exactly. Most people would just give the person like a migraine medicine and say, hey, here's some Imitrex, or here's some, whatever. And then they take their medicine, which helps, but then it's the Band-Aid. It doesn't get to the root cause, right? It doesn't get to the underlying, like, what the heck's going on? Why is this person having this issue? And so it helps, it helps handle that headache every once in a while. But then at the same time, the person just has a mold allergy, and the house or the ducts are just full with this mold. It's like, you got to change the AC ducts. You got to do something about it, or change the house.
Yeah, you obviously see a lot of people. From your perspective, why do you think that we've never been sicker than we are today?
Why have we not been sicker? I think. Well, here's the thing. I kind of feel like there's a lot. There's a lot of different issues that can create people being sicker than normal. I think bodies are interesting in that they require basic things to function properly. I'm gonna give you my long spiel here. So, a couple of things. Bodies are super. What's what I'm looking for? They're very very restricted. There's not a lot. We have a very tight environment that a body functions well in, right? Like, for instance, you can be in an environment that has too much oxygen, and that's actually bad for you, or too little oxygen, that's actually bad for you. You can have too high a temperature, and bodies just don't do well in high temperatures, and you can have too low, a temperature, and the body just doesn't do well. And pretty much everything is like that. So that, everything that the body gets exposed to, water, temperature, humidity, blah, 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 there's always a range that the body can function in. And then the same thing is true for a couple other things. For instance, like body size, for instance, like bodies are meant to be at a certain size. And then what I found is that most of my patients who get chronic illness, they tend to have either too high or too low a body weight. There's like a nice sweet spot where a body does pretty well. And then I have my guys who have a high, body mass index, or my guys that have a low body mass index. And those are my chronic patients, like the ones who are either above or below. Those are the ones that I see frequent flyers all the time because they have some different body issues. That's the first thing. And then the second thing I would say is there's what I call basic body rudiments that the body has to have. Otherwise, it doesn't really function properly. And then it's interesting, but sleep is probably number one as far as basic body rudiments that a person needs to have, like grooved in, where they're just sleeping very well and not having interrupted sleep, getting their, like 8 hours. In fact, I survey patients all the time, and I just ask them for two reasons. One, for them to actually think about it, and then they can think what they need to change. And I go, how many hours do you need to sleep before you feel like you had a really good sleep and feel fully refreshed and can have a great productive day the next day? the common answer for an adult is 7.5 hours. That's like the average. Like they actually say 7.5 hours. And then I ask them, well, how many hours do you sleep? They say 6. Like most people, 6, 6.5, 7. So I'm like, okay, great. Well, is there a way you can get that 7.5? And they think, I guess I could, tweak this, tweak that. And I think probably the biggest thing is what we all do, that whole doom scroll with the phone. 100%, that definitely has changed over the past decade or so, where I remember, even like 10 years ago, 15 years ago, we didn't use the phone as much as we did. We didn't have all this social media, mindless, looking at the phone all night long. We sit there and we sit on the phone till God knows how long. And instead of going to bed at 10 o'clock, we're up till 12. And so instead of getting, 8 hours sleep, we're getting 6. And so I would say a majority of people do that. So that's the first thing that needs to change, is put the phone down, walk. I'm being a hypocrite, but it's hard. You got to put the phone down, put it on airplane. Move it away from you. Put it in another room, because you're going to pick it up and look at it, right? That's probably the biggest thing, is sleep deprivation. The second thing I see is the lack of movement. Like, people don't move their bodies and exercise, right? And I've said this before. The basic purpose of a body is to move. That's it, And so if a body can move and moves well, it's usually going to be pretty healthy. Bodies that don't move tend to not do very well and have a lot of, issues and health issues. So I call them my skinny fat people, the guys who are, they look healthy, their size is normal, but they never exercise. They don't do anything to challenge the body. And
why you calling me out, dude?
No, I'm not saying anything. I'm just saying my skinny fat people who, they have a nice BMI, they're like, whatever, they're the average size you'd expect, but they do absolutely nothing. Those guys have body problems as well, because they don't move the body. So I would say my people who don't exercise probably have, the ones that do, I never see them. Like, I already know that. Like my guys and girls who are fit and exercise, even if they're a little overweight, I don't see them. It's if when they don't move the body is when I tend to see those guys a lot. And then I would say probably the third thing is probably water. I think a lot of people don't consume enough water. So they run dry, and they don't even realize that they're running dry. And so if you've ever played sports, if you ever played any type of sport, I played soccer and football and stuff and whatnot. And if you need water in the body, man. If your body's dry, you can't perform, you can't run, you can't jump. You just feel a little bit lethargic. So, and that's just playing a sport. Now, obviously, just living life and walking around and doing your regular activities of daily living, if you're dry, it's the same effect. If you're dehydrated, you can't move as well as you should. So I'd say it's actually pretty simple, but most people are undehydrated. And then I would say the last obvious thing is the nutrition the person puts in their body, right? I would say that's the fourth basic rudiment. You are what you eat. If you're eating Twinkies and donuts all day, you're probably not going to do very well and feel very well, And then the guys that eat, I like to say one word organic foods, like, carrots, they're like, what should I eat? I'm like, and the people like to restrict and have weird, different diets. I tell them I never have a diet. I eat everything. I eat except for liver. I do hate liver. Anyway, but I eat everything. And then I tell people, if it's a one word ingredient, chicken, steak, whatever, not pizza, but just like simple. I mean, I eat pizza too, but if you just have simple, easy, organic, one word ingredient foods is a majority of your diet, they usually do fine. It's the guys that I see when you go in the grocery store, you see the guys, pushing around their shopping carts. You never see whole food. You always see a whole bunch of boxes of processed food. And then it should be 80% whole food, 20% processed. It's always opposite. You see, 80% processed foods and, boxes and whatnot. And then you see like a couple things of like, maybe they have a lettuce head or something. And it's just like, they're not going to do well. So I can just look in the checkout line and see who's going to be doing well and who's not, just by what they're buying as far as their food is concerned.
It's incredible.
Yeah.
I would invite you to add one more thing, the air we breathe.
Oh yeah, 100%. Yeah, definitely. I missed that. The air is a big part of it as well.
Totally.
Yeah.
Yeah, no, I was messing around with you on the diet part or the exercise part, because it's hard. Like, as a businessman, I'm look at what I'm doing right now. I'm sitting down in a chair.
Right.
And what I was doing before this? I was sitting down in a chair.
Right.
Different location. I was in front of a screen, sitting in front of sitting on a chair.
In a chair. Yeah.
And so if I don't be intentional about getting exercise and moving, I won't get exercise and move. Like, if I just focus on work and don't be intentional about that, for sure, I won't move. And so I'm always like trying to consciously move. I've got the watch that tells me when I need to stand up because I've been sitting for too long.
Mm-hmm.
And like
Nice.
every time I do that, I'm like, all right, I go take a walk, usually to go get water, go to the bathroom, things like that.
Right.
But like water too, as you're saying that, I was like, man, my mouth was getting dry as you're talking about like, hey, we all need to drink more water. It's like, I think about it today. I had maybe 1 glass of water all day today. That's not good.
No,
I had 2 cups of coffee though.
So, which dehydrates you, by the way.
Which dehydrates you.
Right. So, like, and most people do. Most people have their Starbucks, they got their coffee in the morning, or Dunkin' Donuts, whatever they drink, and then they have more coffee than actual water.
Yeah.
And so every day they're getting a little bit less. And they're like, hey, I don't know why I don't feel great. I'm like, how much water do you have? And they just don't drink.
That's where I'm at today. I got to flip the script.
You're going to flip it.
By
By the way, I want to say something. So you're right. As far as the breathing is actually huge. One of the spiels I give my patients, and I forgot to mention this, is, like I said, the basic purpose of a body is to move, right? Well, we have different body systems that help the body do that, right? So priority number 1 is actually your respiratory system. And I tell people this, like I say it probably not 1,000 times a month, but I say it all the time to my patients that, the purpose is to move. And then you got it. The priority number 1 is respiratory. So if you're not, which is basically from your nose to your lungs, because the respiratory system's job is to get oxygen into the body, right? If you can't get oxygen into the body, what happens to you? You drop dead. So anything that impairs the ability of oxygen to get into the body is going to cause problems. So that's why most people come to the doctor, because once they have, the most common reason people come in to see a doc is a respiratory issue, because they can perceive that their body is not functioning properly because if something is obstructing air getting into the body. So you're right. Air.
Yeah, super important. Mm-hmm. But I love what you said. I mean, we got to move. We got to breathe clean air. We got to eat clean food. We got to drink more water and drink good quality water.
Yeah.
I think those are foundations for health. And surprisingly, I mean, I for sure didn't drink enough water today.
Mm-hmm.
I didn't move enough today. Mm-hmm. So I've already gotten 50% of my scorecard.
Flunk.
Is a flunk.
Right.
Yeah.
Mm-hmm.
So, that's what it's like to be a human being.
You know what I tell people though, and no one ever believes me, is do it in the morning, exercise. As soon as you wake up, I always tell people kind of like change your routine, and then, on a gradient, I say wake up 20 minutes early and then just do your exercise in the morning because I know guys like to do it in the afternoon or in the evening. But what happens is you do in the morning, it's done. And then you don't have to worry about, I haven't done anything all day. I haven't moved the body all day. You get your exercise in. And then what happens is when you get your exercise in the morning, guess what happens? You are thirsty all day. You will definitely drink more water than you normally would because you're going to crave it. And it's not forced, because I know these guys that walk around with their, what do you call them? The little fancy Stanleys, the little Stanley, mugs or water bottles. They're not thirsty. They're just drinking because, they were told to drink water. And which makes it like, I don't know. I just feel like it's forced and it's not real. But the ones who exercise in the morning, like I'm getting thirsty now as I'm talking to you. You definitely, I probably drink, let's see. I like milk, by the way. So I drink every morning. I have probably like a liter of milk. I'm crazy that way. And then
we're going to have to dive into that in a minute, but go ahead.
Okay. So, I'm a milk guy. And then on top of that, I have water as well. So I have milk, water, Gatorade. So by 1 o'clock, I probably had like 2 liters of fluids already. So, and then the rest of the night, I probably have about 3 liters every day minimum. And, just because I exercise in the morning because I'm thirsty. So
let's go back to the milk thing. So why a liter of milk a day?
I like milk, man. I just skim milk is my thing. Like I'm weird. I put ice and throw like I just pour it on ice, and I have like my breakfast go-to is I used to be an egg, bacon, cold cut kind of guy on toast. And then I was like, I found my energy didn't last as long. So I'd have 2 slices of toast and then, 2 fried eggs and a couple strips of bacon. And when I was on the bacon kick, my cholesterol went off the charts. I was like, all right, no more bacon every day. And then my cholesterol went back to normal. And then I switched to sandwich pepperoni. Cholesterol was good. But then I found that if I had breakfast I had to eat later, because if I had it 8, by 12, I'm starving. I'm like, okay, that's not working. And then I switched it up. I started doing peanut butter, honey, and banana on bread. And then I'd have 2 slices of that, and I would last, and I have it at 8 o'clock in the morning, and I don't have to eat again until 2, 3, 4.
Wow.
And so when I have that mixture of food, for whatever reason, it just would fill me up. And I was like, man, this is like a hack. This is like a biohack that most people don't know about. For me, I don't know if it works for anybody else, but for me, if I have a glass of milk, 2 pieces of bread, some peanut butter, honey, toast, and banana, I'm good. And it lasts forever. And then I have like today I had a Nature's burrito. I had a before I came here because I didn't know how long. Because right now I usually start to get hungry. I was like, okay, it's about 2:45. I'm like, okay, if I eat now, I should not get hungry during this this show. And so I just shoved the half, not even half. I did like a third of burrito at like 1:30, and I'll eat the other 2/3 later tonight. And then so I can kind of restrict the calories or just kind of pay attention to them. Whereas if I eat other stuff, it just doesn't fill me up. So I found, some foods tend to fill me up and kind of keep the appetite at bay. Whereas other foods, like I find if I do a high protein and low carb, I tend to get hungry like super quick, like 4 hours after. I'm like, okay, I'm hungry again. I have to like mix in carbs. I tend to eat my carbs earlier in the day. Like I find I definitely carb load this. My first meal is always more carbs than the other meals.
That makes sense.
Yeah, and it seems to, because your carbs are, exactly. Give you energy.
First,
exactly. And so you burn energy that way.
So I want to talk a little bit about sleep. I did 2 things that improved my sleep. One, indoor air quality. Improving indoor air quality for sure helps with sleep. I've seen people get air purifiers, plug them in their bedroom, night and day difference. And then I ended up getting this thing called 8 Sleep. Have you heard of it?
No, what's that?
It's basically like a mattress cover. And it actually connects to what they call the pod, and it essentially heats up or cools down water, and it pumps water through the mattress cover in these tubes, almost like radiant heating, right, for the floors, but like for your mattress. Yeah. And so it knows that the first thing it does is like calibrate to you and figures out what makes you sleep better. So what works for me is it heats up before I get in bed. So when I get in bed, the bed's warm, which is kind of nice. Nice. And then after that, I guess like an hour later, it just slowly but gradually starts to cool down. And then by the time I fall asleep, which is usually like an hour after I lay in bed, it then just switches to cool. Luckily for me, I've been able to avoid the doom scrolling. My wife, not so much. I'm gonna have to show her this episode here. Exactly. But I've been able to avoid that. That's been pretty helpful. Like I just plug my phone in and just forget about it. And then I'm like watching TV just to like watch something to fall asleep to. And then I usually like within hour the latest, but usually like even 20, 30 minutes, I'm like done, out like a light. And so it's been interesting because of that temperature. So I was curious if you've heard of it or have heard of anything like that.
I haven't. I've never thought about the temperature. I know I mean, obviously everyone has a nice temperature for themselves that they enjoy. And, cause I've had, in the past, I've had, a girlfriend or, wife or ex-wife, I should say, where they want a specific temperature to, to sleep to. And which is another question as to why women want it so cold sometimes. Anyway. I find there's like a nice temperature that I like to sleep at. And then I'll give you a funny story. So I have a dog. I'm sure you've seen my dog, right? So I have this little dog, Dixie. And then there's a time when, especially in the summer, she gets hot and I'm comfortable. I guess it's my Jamaican roots. I'm like, people are like, what do you set your temperature? I'm like 75. They're like, what are you crazy? You got to drop it down to like 68 or, she would get hot and start panting throughout the night. And I thought she had to pee. So I'd get up and walk her. She was just hot. And so I finally figured out that, my dog, who's a female, needs the AC lower so that way she doesn't bother. She sleeps in the bed by the foot of the bed. And if it's not the right temperature, she'll wake up. So so I have to set the temp for her, otherwise so I'm like compromising again just to to please the woman in my life, which is my dog.
That's awesome.
And then it's that temp, So
yeah, it's interesting, because I actually like it warm too. I'm not a big cold person. Right. I did move from New Jersey to Florida, I feel like for a very specific reason. Exactly. Just like the warmth. But I did notice that the app does make it cold when I sleep because you could see it shows you the temperature or whatever. And it showed me that when it went colder, I slept, my REM was deeper and longer versus when it was warmer. And I was just like, well, that doesn't make any sense because I don't like the cold. But apparently while I'm sleeping,
you like the cold.
I do. Again, I'm not even aware of it, like subconsciously. If I was awake, I'd be like, no, this ain't for me. Right. But obviously I'm not conscious at that point. I'm like in deep sleep.
Right.
But apparently like while I'm deep sleeping, it's like very good for me. So I just found that interesting. It's like the decisions that I make would be warm. I like it warm and toasty. Right. But hey, the body's a funny thing.
I might want to try that now. Just, see what my body actually likes. Maybe I was wrong. Maybe it's supposed to be cold. Who knows? Interesting.
And then it'll turn out that the women in your life were right.
Exactly. Oh well.
So going back to chronic illness for a minute, I know it's a more serious topic, but you obviously see a lot of people. You're going at the root cause. You're building the foundation. You've mentioned that you've seen some people who have had some issues with mold. Obviously, environmental toxins is a huge topic. I'm just curious how you keep up with all this stuff. Medicine's always moving forward and evolving, and we're learning new information. New studies come out all the time. But you're a very busy guy, and you see such a wide range of issues.
Right. How
do you keep up with all of it?
That's the one thing I like about medicine is I feel like you never know everything. You have to always learn. Like I learn all the time. Like every day I learn something. And so that's the game. You never stop learning. There's always new tech, new ways of handling things, new discoveries, new things that, people didn't really think with, that you can apply to a body and actually help the person improve the function of their body. And I think for myself, I've always felt like that's just how I operate. Like I don't feel like I know everything. And then I'm always willing to learn. I'm always willing to, read and figure out the newer discoveries and apply it to my practice and what I do. It's interesting because, for instance, one of the newer discoveries about the body, you know what your lymphatic system is? Right. So you're basically, your cells live in a wet environment. It's not a dry environment, right? So you have this fluid that kind of coats in the cells live in, called interstitial fluid, right? So this fluid is collected by your lymph system. So your lymph system drains that fluid through lymph channels through your body. And then everyone knows what lymph nodes are. Like, when you get your swollen lymph nodes in your neck, your lymph nodes, drain as well. And everything kind of drains in these lymph channels back into your heart eventually, right? Into your big vein and that dumps into your heart. And so the fluid is always being recycled. So it's always kind of being recycled. And that's what the lymphatic is. For instance, if this is how you can tell, sometimes you can tell if a woman's had breast cancer because they have one extremity bigger than the other one. So for instance, their left arm will be swollen because when they had their breast cancer, they might have had a lymph node dissection where they took out the lymph nodes and interrupted the lymph channel. So then the fluid can't drain properly. So the arm's a little bit bigger than the other arm. And so if you ever see someone that has a slightly bigger arm, it could be because of a blood clot, like blocking the flow, or it could be because they had a surgery and then the surgery messed up the lymph system. And so now the lymph system doesn't drain properly. The fluid backs up, blah, 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 right? That's how the lymph system pretty much handles. You have a separate system in your brain that's different from the lymphatic system called the glymphatic system. And so the glymphatic system basically drains the fluid that surround the cells in the brain. And so it flushes that fluid out. And so what happens is the glymphatic system basically, it only operates when the person is actually sleeping. So it's like having a fish tank that you have to refresh and clean the fluid out. People that don't sleep well tend to not have their glymphatic system flush properly. And so they tend to build up, residue and deposits. And so what's funny is when we see people who have dementia, they tend to have a lot of deposits that they can see on MRI. And what we're realizing is that those deposits in their interstitial fluid in the brain tissue, not actually the cells, is actually the debris that's just never got a chance to get flushed out and cleaned out properly because they're not sleeping properly. So again, sleep is huge for the body to function properly. It's relatively new discovery. Like I'd say the past maybe 10 years or so is when they kind of came out with that data and it was like, hey guys, we just realized something. Your glymphatic system actually only functions at nighttime. It's like, oh wow. And so I didn't know that. I was like, that's one thing I learned probably a couple months ago. I was like, wow, that totally makes sense. And when you apply it to what I've seen over the past, however 30 years in medicine, it totally makes sense as to why that is and why that would be. And then now what they're doing is because they've discovered that, they're starting to target different medicines to kind of help handle those deposits. And what's funny is it kind of makes people realize, sleep medicine is actually pretty huge. Like if a person, doesn't sleep well, they potentially can have a lot of issues with memory and cognition later on in life.
Sure.
So, which is interesting.
No, it makes sense.
Yeah.
So as we get near the end of the show,
Yeah.
there are two big questions I like to ask everybody.
Yeah.
This is the stuff that gets shared typically.
Okay, cool.
So the first thing is, this one's going to be an interesting one for you because you've been in so wide of a range of medicine that I'm really genuinely interested in your response. But what is the biggest lie in medicine that you've come across that you were just like, wow, I couldn't believe that wasn't true?
Probably the biggest thing that I see that we don't really talk about is this thing called essential hypertension. So a person comes in and they say, you have essential hypertension. Here's some meds. Have a nice day. And then I've kind of realized that there is a cause. Essential hypertension basically is high blood pressure where we don't know the reason why. To me, probably the biggest reason why is just the person isn't actually using their body with what it was supposed to be doing, which is actually moving. So exercise is huge at lowering blood pressure. And then also body size as well. So a lot of guys, I have patients who are like, hey, my blood pressure is going up and their pressure is, 150 over 100. They don't know why their pressure is so high. And then I'm like, hey, you know what? Let's look at your stats from the past couple of years. And I'll show them their stats. And it's like, when they came in and saw me, their weight was like 150. And then, 2 years later, it was 160. And then next year it was 170. And now it's 180. And then you can see the blood pressure go up slowly with it as well. I find that as far as essential hypertension, especially for men, it's usually directly proportional to their weight. So if the person gets their weight back down to a normal or more normal, size, and they exercise, the pressure goes right back to normal. So all these guys are cranking blood pressure pills all day, every day. And the handling, I think if people really understood that, like the one guy I'm thinking of just popped in my head. I said, hey, just lose the weight. It'll come down. I won't see you anymore. And you know what he did? He lost the weight. I don't see him. Like he doesn't come in because he doesn't have a blood pressure problem anymore. And so it's like, people aren't told that, the root cause of certain things. Because if you hack the person and teach them and they get it and they duplicate it, they can fix it. Once they go, oh, that makes sense. Okay, good. Patient handled. You've given them the knowledge. They're not going to come back. They get it and they fix the problem. It's when they're like, oh, you have high blood pressure. Here's your blood pressure medicine. I'll see you in 6 months. That's a good way to make money. You see them every 6 months or every 3 months, whatever the case may be. But the reality is you could help that guy a little bit more and actually tell him and give him the reason. And the funny thing is, if you look up all the stuff on essential hypertension, there's nothing about weight. It's all, hey, you have essential hypertension. We don't know why, but you have high blood pressure, and there you go. And it's true. There's other little nuances as to, why the pressure could be high. But in my experience, when you really look at it, if the person drops their BMI like a couple points, you lose a patient. You're not going to see them anymore because they understand why, and it's done.
Yeah, I like that. One of my favorite things to do is work myself out of a job.
Mm-hmm.
Like I help a family.
Yeah.
We eradicate their issue. It doesn't come back.
Right.
I'm out of a job. However, you're kind of acting on that same premise.
Right.
And that's a really amazing thing because in medicine, specifically when people are prescribing prescription medication, there's always a plan to get them on it.
Right.
But never really a plan to get them off it.
Right.
And then, to be told, and people are commonly told, you're going to be on this medication the rest of your life.
Yeah.
It's pretty defeating to hear something like that.
I don't tell people that.
That's amazing.
Yeah.
That's why you're here.
Okay.
You're part of the team.
Yeah.
You're doing the amazing work.
Mm-hmm.
I like to call it God's work. You're doing the amazing work and you're making sure that.
I should be honest. There's a few things where they're going to be on the med for the rest of their life, but I would say 90% of the time that's not true.
Yeah. Sure.
Yeah.
I love that.
Yeah.
So the other question is controversies. Sometimes controversies, they spread like wildfire. And it's usually because there's some shred of truth in them. And so I'm curious, what's a controversy you've come across in your field that's actually true?
One of the things that's kind of in the air that's a little bit confusing for people is the whole game of cholesterol and lipids in the blood, and is it a big deal to have high fats in the blood, right? And for some reason, the trend is now people are saying it doesn't matter, it doesn't make a difference. And then I make it super simple. Like, I actually think it's true. I know there's tons of people who disagree with me, who think that cholesterol is not a big deal. I just make it super simple. I'm like, look, you have a pump, right? Your heart, and then you have the pipes, the blood vessels, and then you have the juice, the blood, right? And then I ask them the question, what is easier to suck through a straw, water or milkshake? And they go, water. Okay, great. People who have high lipids or fat or cholesterol or whatever, triglycerides in their blood is like a milkshake. Done. And I go, oh. And then I go, okay, that makes sense. Because I have people who, they argue with me about, it doesn't matter. I've seen studies that say that, okay, fine. Or if this doctor is saying it doesn't matter, I'm like, okay, that's fine. They can say that. They can have their opinion. What I see is the guys who have that, who have high cholesterol, high triglycerides, they tend to have a high blood pressure. Why? Because the blood's thicker. The heart's going to have to use more force to move that stuff. I never see people with high cholesterol or high lipids that have a normal blood pressure. It's always a little bit higher than normal. So that means the heart's working a little bit harder, and that creates this whole cascade of problems for the entire body. So I'm like, cholesterol and lipids and triglycerides, yes, they do actually make a difference. You don't want to have high numbers. So despite what other people say, 100% disagree. I think that controversy is, to me, not controversial. What do you want? Water or milkshake flowing through your pipes?
I think I would pick a water.
Exactly.
Instead of the milkshake.
Exactly.
Interestingly enough, I think why that whole thing kind of unfolded that way is because you have the popularity of the keto diet.
Big time, yeah.
Right?
Yeah.
And people are misunderstood about the keto diet.
Right.
The keto diet doesn't say eat bacon 3 times a day.
Right.
You've already alluded to the fact that, when you started eating bacon every day, your cholesterol went up.
Right.
Right? You don't want to have milkshake through your veins. You want to have water through your veins. Good. So you cut out the bacon.
Magic.
Problem solved.
Cholesterol went down.
But you're still essentially eating protein, right? I mean,
Right.
you have bread and stuff. So no,
Yeah, I eat protein every day.
Might not be keto, but that I think the popularities of some of these diets, the misunderstoods on the diets themselves, right? Where people eating too much cholesterol or too much fat,
right?
And maybe the less healthy fats that could increase your cholesterol,
Right.
then causes people to say, well, I don't understand. Everybody's on keto. Everybody's talking about keto.
Right.
Therefore, it must not be that my cholesterol matters. But there's actually a way to do keto and not have high cholesterol. It's all about choosing the proteins that you're eating and maybe not consuming bacon 3 times a day.
You can be a carb junkie and have high cholesterol. So it's not necessarily necessarily the diet, but I always tell people, just mix it up, man. Just mix it up. You should have a variety of everything. I'm not a huge proponent of any specific type of diet, like, carnivore, keto, Mediterranean, whatever. I mean, all these different diets. I tell people, just eat food. And then if you can maintain a decent, BMI or body mass index, I don't care. If you eat a good, whole, organic food. I talked to this lady, Liat Golan, one time, and we were talking, and she has the 80-20 rule. She's like, 80% of the time you eat clean, organic food, 20% of the time, have chips or who cares? It's like, whatever, you can splurge every once in a while. And she's right. If you tend to eat relatively clean, you don't have to necessarily restrict and avoid certain things. You just, as long as you, moderation, with the other stuff. Like, I have pizza every once in a while. It's not a big deal. I love pizza.
Yeah. I like pizza too, but
yeah,
I can't eat it.
I can't have it every day. Exactly. I have it like once a week or once every couple of weeks. Not a big deal.
Yeah. That's awesome.
Yeah.
Well, I really appreciate taking time out of your busy day, to be here with us and share more of your vision and your story. And I think it's really important that we have these conversations because obviously we want to be healthier.
Right.
We want to be cause over that and control our health, not be this total effect of it. So I really appreciate everything you shared today. Where can people find you? Where can they learn more about you? If they're in the greater Tampa area, where can they come see you? I
have a clinic in Clearwater. It's right down the street. It's downtown Clearwater, and it's called Bayside Urgent Care Center. You can Google it, look online, and then that's pretty much where I live. They're usually 5 days a week, and then that's where you can find me.
Awesome.
Yeah.
Well, thank you so much for taking the time today. And thank you for joining us for another episode of Never Been Sicker. I'm your host, indoor air quality expert Michael Rubino, and I'll see you soon.